Well, good morning to you. Thanks for, first of all, thanks for doing this. And for you guys that are checking this out on YouTube, usually we stream about the first 15, 20 minutes or so, and then we kind of just send everybody to Revero.health. So if you want to catch the whole interview, you can go there. Megan, as you probably remember, we've got a bunch of people in here. They're gonna ask questions in the chat. I'll try to relay them to you as best I can. So just remind me, Megan, I know you and I don't know if it's still the case, but I know last time I talked to you, working at IDM with Dr. Jason Fung, and I can't remember exactly what part of the world if you were in Canada with him. And
Yeah, I've worked with Jason since I was 15. I'm 37, so I've known him for a while. Jason and I co-founded a program called IDM, which is short for Intensive Dietary Management. It's since gone on to change names, so we're called the Fasting Method now. And I'm born and raised like 8th generation Torontonian, but I'm currently living in the San Francisco Bay Area of California. So recently had a bigger move.
I see. Okay. So are you still doing with the fasting method then? Is that still part of what you're doing then?
Yeah. So someone needed to be down in the US to help set up some US operations. So Jason and I co-founded the program. It's growing. We actually just launched our first ever app on August 30th. So we're really excited. We just needed someone on the ground here in the US to get things going.
Gotcha. Okay. Well, good for you. Yeah. I just recently left California to move to Washington State. So it's cold and rainy where I'm at today, which is unusual for me for September. Normally, I'm sure it'd be sunny and warm, but San Francisco is kind of a mix in between because I got kind of chilly out there sometimes. Well, tell me, so you started the U.S. leg of this, which is great. With regard to, the fasting, tell us about some of the success rates you guys have had. How has it helped? Who has it helped? What kind of people are utilizing it?
Yeah, so Jason Fung and I started out with a mission to get as many type 2 diabetics off medication with better glucose control without it. And we were extremely successful. I'm fairly confident in less than 6 months, we can get people off of most of their type 2 diabetic medications. And they can go on to have hemoglobin A1Cs much better when they were on all of that medication. And from our data in the clinic, we've been able to successfully take people off of insulin within less than 2 months. We published some case reports and case series too, where everybody was off of insulin in less than 3 weeks, and they had better control glucose without it. And years later, they still don't require any of it. So that was really our mission. We sought out to help people reverse type 2 diabetes. And then we saw not unsurprisingly, I saw the profound fat loss that accompanied all of this. But since our initial days, we've really started to work with individuals diagnosed with fatty liver disease, especially those that look very slender. We call them TOFIs, thin on the outside, but fat on the inside. So they have lots of organ fat, visceral fat. And we work with a lot of women with polycystic ovarian syndrome. So polycystic ovarian syndrome, disease of too much insulin. So now we use therapeutic fasting protocols to really tackle any conditions that are the result of excess insulin, hyperinsulinemia in the system.
Yeah, that's awesome to hear. And I'm just wondering, as far as fatty liver disease, because it's been around, obviously been around for quite a while. I used to be associated with alcoholism, but we've gotten, I think the majority of fatty liver is now non-alcoholic, if I'm not mistaken. Yeah. And we see it in association with metabolic syndrome, obesity. And then you described the TOFI situation, how are you assessing fatty liver disease? Is it all strictly imaging, or there's something called fatty liver index, which is some lab values looking at triglycerides and GGT and I think waist circumference and BMI. But how are you? What's the success rate with fatty liver, and how long does that take to respond?
Usually, it's incredible. I was diagnosed personally with fatty liver at the age of 12. And so, but I was considered underweight by my BMI. In retrospect, I now know I was just this little skinny sack of fat. And I'm pretty confident that my fatty liver was due to excess apple juice consumption. and that was the cause of it. And I reversed my fatty liver disease in about 6 months, if not less. So we used a combination of the metrics that you talked about. So looking at the liver enzymes, looking at triglycerides, looking at waist to the hip circumference, but also imaging. So back home in Toronto, we would do a lot of abdominal ultrasounds so long as the liver wasn't obstructed by gas or other sorts of obstructions. I've learned in the US the go-to here always seems to be CT scans since I've been living here. But we would just do abdominal ultrasounds every 6 months.
Yeah, I think even better is an MRI scan, but I mean, obviously that's cost prohibitive. And the problem, I guess one of the criticism with ultrasound is it's a little bit user dependent. The skill of technologists can sway that a little bit, but clearly we're seeing there's a lot of literature out there showing low carb diets, fasting, other things have been effective at fatty liver reversal. As far as, obviously there is a disease treatment fasting versus maybe a maintenance fasting sort of situation. So how do you kind of sort of walk people through that progression as far as, say somebody comes in obese, diabetic, fatty liver, maybe they have PCOS as well. How does that person differ from someone who's, gone through that? And what do they look like a year later with regard to their fasting?
Yeah, so usually when someone comes in, the goal is to get them into a more therapeutic protocol. So therapeutic protocols under the fasting method umbrella are 24, 36 hour fasts done 2 to 3 times a week. So when you're doing a 24-hour fast, say you'd fast from dinner yesterday into dinner today for 24 hours, a 36-hour fast would be a full day fast. So Monday you fast, Tuesday you eat. You can eat breakfast, lunch, and dinner, or most often people just eat lunch or dinner. And that's more like a 40 to 42-hour fast, which is fine. But the goal is to fast for an entire day. And those are 2 of the base therapeutic fasts that we would do for metabolic issues. If people find fasting 3 evenings a week to be too restrictive for them under family circumstances, then we'll encourage them to do 2 48-hour fasts a week. So you'd fast, say, from Sunday evening to Tuesday dinner, from Wednesday dinner to Friday dinner. That way you're only missing meals with your family on Mondays and Thursdays. So it's less restrictive on the people in your household, or less restrictive socially if that dinner time is important to you. And that's usually what we keep people on anywhere from 6 to 12 months, depending on the severity of their metabolic health. And then after that, we move into more maintenance strategies. And the maintenance strategies do truly depend on what the person is eating. Now, at the fasting method, of course, we promote real food diets. We're not agnostic towards a diet. We've seen all people get great results with low carb, with keto, with carnivore. So it's about finding a balance of what you can do, what you're comfortable with, and what your results actually are. So we definitely push people towards the real food options, but every now and then we have individuals in the community that just are not necessarily keen on going towards a real food diet. They still sort of follow more or less along the standard North American lines of things. So, I mean, they will continue to do more therapeutic fasting at those levels to maintain, even once they come off of their insulin and are able to get better control of glucose. But for individuals who do go into one of these real food approaches that work for them, such as carnivore, then most people will fall into a 1 meal a day strategy, at least Monday through Friday. When we reverse all of that metabolic disease and we're eating real nutrient dense food that's fueling us, so giving us plenty of fat and protein, most people find that they don't need to eat multiple times a day. So many individuals will do sort of the OMAD, just 1 meal a day as maintenance. And then on the weekends, maybe continue that or do 2 meals a day on the weekends to change things up. We typically encourage people to do 1 to 4 extended fasts a year, meaning 3 to 7 days, just for disease prevention. And to do some autophagy. So if you can do an extended fast, you probably should about 1 to 4 times a year. And that's what I do now in my regular life. Typically OMAD throughout the week, usually 2 meals on the weekends. And then every quarter, I tend to do one of these longer fasts just for disease prevention. We still eat out. There's still hidden vegetable oils on grills. We might think that we're ordering the best possible food, but they'll throw some vegetable oil on the grill where they're cooking our meat. Then, traveling, jet lag, all of these things cause hormonal issues, stress. So doing some of these longer fasts periodically is a great way to reset. So I reversed my fatty liver, my type 2 diabetes, and my PCOS 10 years ago. I got diagnosed with type 2 diabetes on just before my 27th birthday, and I just turned 37. And after 6 months, I've just been maintaining like that for the last 9.5 years. And it's just further improved my health.
Let me ask you about, because often the criticism regarding fasting is, it's no different than caloric restriction, in that the only reason fasting is making a difference is because you're reducing your caloric intake. Now, I mean, have you seen anything that would either agree or disagree with that? Do you guys track in your clinical studies how many calories people are eating, and other results equivalent or not equivalent?
We haven't done that in our clinic, but there have been quite a number of randomized control trials that have come out. The most prominent one in 2016, but it's been replicated now a few times, where they compared alternate daily fasting to calorie restriction diets. So in the 2016 RCT name, I can't remember to save my life in this moment, but I can send it over to you. The alternate daily fasters consume 0 calories on their fasting days. And on their eating days, they were instructed to maintain their regular diet, eat as much as they want, eat the same foods that they usually do, not to change their diet. But on alternate days, they would fast. The calorie restriction group was instructed to reduce their caloric intake by 400 calories a day. And they followed these groups for 32 weeks. And at the end of the trial, the alternate daily fasting definitely won out as superior. So we saw more total fat loss, more trunk fat loss. So that fat in our abdominal section, our midsection, that's tied to so much metabolic disease. We saw a greater retention or increase in lean mass, and we saw no clinically significant change in resting metabolic rate. So this is the first RCT that came out that was a larger trial comparing alternate daily fasting to caloric restriction for fat loss. And they've since have replicated that now 3 or 4 times with the exact same findings. And when you're doing calorie restriction, say you are reducing your calories by 400 or 800 calories a day, the body starts to acclimate, like it cuts costs. I think in 2020, so many of us, were conscientious, financially because of the whole state of the pandemic. So we started to cut costs, and say you're trying to reduce your household income by about 25% because of the unknown. You would be able to do so. You would cut back on your expenses. Maybe you would take buy food that's on sale versus just buying the food that you see that you like. You could buy clothes that are on sale versus buying the outfit that you see that you like. But we could all figure out how to cut those costs. And that's what happens when you do calorie restriction diets. You're just cutting your energy budget for your body. So your reproductive system cuts costs, your respiratory system cuts costs. So all of your body systems will cut costs to acclimate to the lower caloric intake. But when you're doing true alternate daily fasting or true fasting, I mean, there's no caloric intake, or maybe you have a tablespoon of heavy cream in a coffee or a teaspoon, which is very insignificant. So when you're actually in a true fasted state, your body activates your sympathetic nervous system. That's your flight or fight nervous system. And it produces these counter-regulatory hormones, which do a lot of the things that are magical, or magically attributed to fasting. So we do get some mild cortisol production, but a little bit of stress on the body's good, and that ensures gluconeogenesis for the little bit that we need that to occur while we're in a fasted state. But you get the noradrenaline, which helps you access your fat stores, burn fat, maintain your resting metabolic rate. You get the human growth hormone production. So this is why when you look to these RCTs and it shows that there's greater preservation or an increase that's much more substantial in the alternate daily fasting group for lean mass and the calorie restriction group, well, you're generating growth hormone when you're fasting. Now, you're not growing while you're in a fasted state, but you're generating the growth hormone. So when you re-enter the fed state, you've got sort of the perfect storm for helping to gain lean mass. So you've got human growth hormone, you have amino acids from the protein that's consumed, you have a bit of insulin from the meal that was just consumed. And so we actually see individuals lean mass go up. And I'm talking individuals that are much older, that are not going to the gym, that are just doing their chores at home and being able to gain lean mass. So we would assess body composition on these individuals, and they'd be gaining like 4 pounds of lean mass over the span of 2 months without going to the gym and starting to lift weights, although we're big advocates of weightlifting and strength training at the fasting method, but just doing their regular activities.
Yeah, Megan, I apologize. My computer's been dropping me in and out, so hopefully it hasn't been too disruptive. So you mentioned like a little bit of heavy cream or something inconsequential. There's some people that will say that we're constantly sloughing off cells into our digestive tract, and we are digesting those. We turn over our gut lining every day. We're getting X amount of protein grams from that. So maybe it's truly impossible not to take in some sort of nutrients because we have recycling mucus and all this stuff. What is truly inconsequential and what is not? I mean, I know, does this break my fast? Does drinking coffee break my fast? Is there like 100 calories is no big deal, whereas 500 calories is going to throw you off? How do we look at that?
Yeah, that's a really great question, Sean, and something that we're asked because so many people are striving to fast for autophagy, which is that deep cellular recycling, which is great for disease prevention and anti-aging, or certain people with different disease processes, like cancer, metabolic cancers, for example. So Jason, my partner, he wrote the Cancer Code. So there's a lot of people looking to experience autophagy for this cellular recycling benefit. And we're not quite sure, what really influences a fast. It makes it sort of a true fast versus a modified fast. And at our clinic, when we first started fasting patients, everybody was doing 24 to 36 hours, 3 times a week. And we permit them to have tea or coffee with nothing in it, water, and they could have 1 cup of bone broth, and it had to be homemade bone broth a day. And they're doing these 36-hour fasts most of the time. And these are individuals in their mid-60s to mid-70s. They're losing 100 to 200 pounds, and they have no loose skin, or very little loose skin. So we know that a lot of autophagy is occurring, even though that they are getting some nutrients from their own body processes that are occurring during the fast, from that 1 little 8-ounce cup of bone broth that they're having, from that black coffee or the green tea or herbal tea that they're having with nothing added to it. We do know that they are seeing this loose skin disappear and autophagy is happening. Skin tags are disappearing. C-section scars are disappearing that have been there for 40 years. Like, we're seeing all of this great signals that autophagy is actually happening. So all of our clinical practice is based in Canada. We're run through public health. So we're kind of limited as to what we can and can't do from testing. But we've always felt that, if you can do a fast and have water and have tea and have coffee. Of course, good quality tea and good quality coffee. You don't want to get stuff that's riddled with mold and mycotoxins. But that seems to generate quite a lot of observational autophagy related changes in individuals. And we encourage things like having that 8 ounces or less of bone broth, or having that fat in the tea or coffee, not very often throughout the day, or not. If you can do a fast without it, you probably should. We encourage people to have it. If you're struggling and you're someone who knows that you say you need to do a 42-hour fast and you can't get past that 24-hour mark, then have that tablespoon of fat, then have that little bit of broth, because the benefits of getting in an additional like 12 or 18 hours of fasting is so much greater. So we really look at these items as training wheels or crutches. If you absolutely need them, use them. But if you can walk without a crutch, walk without a crutch. Don't inconvenience yourself. And we've found that this approach has been very beneficial in generating those observational autophagy results that we're able to see. So, we've never really stuck to any sort of rules, as do not exceed 300 calories a day. But I've seen individuals taking upwards to about 500 calories a day in heavy cream, something that Mark Sisson says. He said it in his recent book about fasting. We interviewed him as part of our fasting method community, and he said it's our human nature. If we have something that we find comforting or something that we enjoy, and it is quote unquote permitted, it's in our human nature to see how far we can go with that. So heavy cream is something that a lot of people, like, that's their baby blanket, that's their safety blanket, and they love it, and it provides them with comfort. And I'll see people try to take upwards to about 500 or so calories of heavy cream a day during their fast, and we're not getting the results that they want. And they're not taking it because they need it, but they're trying to push that limit for how much can they have and still experience weight loss. And after a couple of months of that, really having the tough conversations with, we've got to cut back. We only need to use it out of necessity. If I'm doing one of my 7-day fasts that I do quarterly, I try to do it with water, the occasional cup of tea. I don't drink coffee, personal taste preference. There's no other reason for that on my behalf. But if I occasionally need a little bit, say like a tablespoon of coconut oil or a teaspoon of coconut oil, if I take 1 teaspoon of coconut oil on day 3 of my fast, and that enables me to do another 4 days and get in my full 7 days, there's tremendous benefits there. So it's just not me taking tablespoons of coconut oil because I enjoy it throughout the day, although I don't know who does that with coconut oil, or butter, or alternatively, which would be a lot more enjoyable than coconut oil. So that's been our mentality. And we have seen things like 500 calories a day really not get people the results that they want.
Yeah, thank you for that answer. There's a number of questions coming in, so I'm going to try to address them. One, I think Brett was asking, have you seen, I know you mentioned PCOS, diabetes, weight loss. Have you seen any impact on mental health with regard to fasting? Does it seem to be beneficial in that regard?
Yeah, absolutely. So many people report being able to come off of anxiety medications, antidepressants, improvements of anxiety and depression. I experienced that myself personally. ADHD is another one. So many of us, I had no problems when I was younger, but suddenly in university became dependent on Vyvanse to even be able to tie up my shoes and have the focus to do that. And so many people in adulthood are finding that they're needing to rely on Vyvanse or Adderall just to sort of get through the day and develop ADHD later on, like I did, and then just not needing it anymore, having that mental fog gone, having that mental clarity, that focus. That's been a huge blessing in my own experience. We have had patients in the clinic that have been able to reduce or eliminate certain bipolar medications as well. It's been so fantastic to see those individuals thrive. And we've done some training with a psychiatrist from Toronto who works with individuals with schizophrenia, because the medications that they take often cause insulin resistance. And it can be very difficult for a schizophrenic patient to be able to change up their diet. So in Toronto, I have a cousin with schizophrenia, and he lives off of government assistance, and it's very difficult to talk to him about his diet, and he thrives off of fast food, but he likes the challenge of fasting, and you can somewhat make it into a game. And he's lost a significant amount of weight working with this psychiatrist at CAMH, which is our Center for Addiction and Mental Health in Toronto. So there's some interesting practices there where it can be used as an alternative in certain cases when dietary changes can't be made for in certain situations.
Okay, another question was regarding women and how to fast around sort of menstrual cycles. Is there a time in the month that's better to fast? Does the menstrual cycle impact that in any way?
Yeah, it absolutely does. So women have two phases to their cycle. They have their follicular phase, which is weeks 1 and week 2. And then they have their luteal phase, which is weeks 3 and weeks 4. And we experience different hormonal changes. So, hormonal changes leading up to ovulation, which is in the middle, and then preparing the body for implantation, leading up to, in the luteal phase of the cycle. And a lot of women who have monthly cycles don't understand what's going on with their bodies. Some weeks it feels so easy to fast, and that maybe they could do an extended fast, and other weeks it feels very difficult and they think something's wrong with them, but it's just the ebbs and flows of our hormonal cycle. So in the follicular phase of the cycle, the first 2 weeks, estrogen is dominant and in our cycle, and progesterone is very, very low. Testosterone is a bit low. And estrogen is an appetite suppressing hormone. But when we get into the second half of our cycle, the luteal phase of our cycle, estrogen levels drop and progesterone levels become the dominant hormone. Testosterone increases a bit. So progesterone in particular is a strong appetite stimulating hormone. So usually when we're working with women, we try to do more intensive fasts during weeks 1 and weeks 2 of the cycle. And then what we do in the second half of the cycle really depends on their goals. Are they just looking to improve their metabolic health, or are they actively trying to get pregnant? But in general, during the second half of the cycle, if someone was actively trying to get pregnant, we would focus, some 24-hour fast, but mostly 2 meals a day during that second half of the cycle. But for most women just looking to improve PCOS and aren't concerned about fertility at the moment, we would do shorter intermittent fasts. We definitely wouldn't do extended fasting. And sometimes women find that 4th week of their cycle is just too difficult to fast. So we would focus maybe on more fat fasting strategies. So, pick like eggs, a fatty cut of beef, some fish, just eating chicken wings, eating 3 or 4 fatty foods over and over again in repetition for that week, and really focusing on the diet during that week. So we try to teach women to go and to plan their fasting schedule around these ebbs and flows in their monthly cycles.
Okay, so here's another question. I guess you can address this either in the terms of intermittent fasting, within the day, or, even with the extended fasts, is eating late in the day versus eating in the morning. If you're going to start an extended fast, should you eat dinner? Should you eat breakfast? Or if you're doing intermittent fasting, should you eat breakfast? Should you eat dinner? The circadian rhythm, circadian biology, does that have a significant impact here, or is it kind of just do whatever you think best?
You got to do what fits into your lifestyle at the end of the day. We struggle with this with patients all of the time, is that they try to fit this perfect mold. And if you need to be eating dinner, you need to be eating dinner. I was someone who always ate my largest meal of the day at lunchtime and didn't eat dinner. When I lived in Toronto, my husband worked at home and he was a great cook, and we would always eat sort of between 1 and 2 o'clock every day. Now he's not home, and my days are too busy with my team being on the East Coast and me being here on the West Coast, and lunch isn't happening. So dinner hour, it is. And so, if you are doing fasting, if you are doing time restricted eating, you're not snacking, you're not eating refined and processed sugars and fats, you found a real food diet that works for you, you're being really mindful of your sleep, then you're doing great. So don't try to rearrange your whole life. But we found people have a lot more success taking their larger meal in the middle of the day. It improves sleep. We see faster recovery from insulin resistance. People tend to not struggle with evening eating issues. We avoid that 4 o'clock crash and burn. We find that it helps people restore thyroid hormone imbalances and adrenal fatigue symptoms. So in general, if you can eat earlier, you probably should, because we've seen it have so many far-reaching health benefits.
Yeah, I mean, that reflects my personal experience as well. I do better when I eat earlier in the day, for sure, for a number of reasons. So here's a question, and I know you just kind of briefly touched on this, but I get this question quite a bit. I think it's a topic. A lot of people have obesity. They do end up with loose skin. They don't know what to do with it. If it's a lot, they have to have surgery to have it removed. But have you guys got some validated results on loose skin, and how long does it take, and what kind of results can you expect to see with fasting and loose skin?
That's a good question. And it's something that we get asked too, from our patients that come from us from the start. They're always actively fasting throughout their weight loss journey. And anytime they start to get quote unquote a little loose, or feeling that things are getting a little loose, we'll throw in an extended fast to tighten things up. But definitely over the last several years, people have come to us after losing weight without fasting being a component of their weight loss journey. And they do have a lot of loose skin. And we haven't seen anything miraculous. Fasting has seemed to tighten things up a bit, and it really depends on how much fat is lost. But we've seen it be more effective when fasting is part of the weight loss journey from start to stop, or at least midway through, than having someone say lost 120 pounds and then having the loose skin and then trying to fast to get rid of the excess loose skin. We've had one success case in that respect, and it was a cousin of mine who didn't take my dietary advice, but managed to lose 100 pounds. And then at the age of 26, started to do extended fasting or therapeutic intermittent fasting. And he's seen a reduction in his loose skin, but he's still going to go for surgery because it just has been taking too long. So we haven't seen people be able to sort of catch up after the fact, if that makes sense.
Yeah, that's fine. With low carb diets, fasting, concerns around thyroid health. There's a specific question here. They're asking, what if I have a reduced thyroid function, either hypothyroidism or I'm missing part of my thyroid?
I'm sorry, Shawn, you cut out on my end. I think the question.
Okay, so I was. Can you hear me now?
Yes. Thank you.
You can hear me? Okay, so yeah, there's a question regarding thyroid function. What about people with reduced thyroid capacity, either through hypothyroidism or even surgically partially removed thyroid? So how do we deal with that with fasting?
You can absolutely fast. There's no contraindications here. The only thing is when you're fasting and you're reducing cellular inflammation, and if you're on medication, you might experience symptoms of hyperthyroidism. So what we do is we tell individuals just to go to 2 meals a day. We do some blood work, we adjust their medications downwards. And once they feel like those hyperthyroid symptoms have resolved, then we go back up to their therapeutic fasting. but we've had quite a number of individuals that have been able to come off their thyroid medication and see reversal of their hypothyroid symptoms. And then individuals who have not much thyroid tissue left, either surgically or just from autoimmune hypothyroidism, like Hashimoto's thyroiditis, where part of the tissue is damaged, we still see people being able to reduce their medication requirements in a lot of cases, which is great, just by the overall benefits of reducing cellular inflammation in the body through fasting. So we've seen some really great outcomes. Again, we would only restrict fasting in the states where someone is experiencing symptoms of hyperthyroidism in the moment that aren't controlled. So we would want to get that controlled first before doing fasts. But otherwise, we've seen it be quite beneficial. I got tested for hypothyroidism myself when I was 9, and have had issues with it, and fasting has only made it better.
And I don't know if there's a true answer to this, but somebody's asking me, about autophagy. Are there any clinical markers that would indicate that you are, yes, indeed, undergoing autophagy? I mean, my understanding is it's kind of going on all the time anyway, but it ramps up in degrees. I mean, like ketone levels or anything, any markers that you could think of that would indicate that you are effectively undergoing significant autophagy?
Nothing that I can think of. People are always asking how they can measure it. That there's no real way. We've always resulted on the observational signs, like scars improving, skin tags going, loose skin going, changes in skin, texture and quality. So we've always gone off those observational studies, but we've never found a marker that says at these levels or at this state you're experiencing autophagy.
Yeah, and I think it was a quote attributed to either yourself or Dr. Fung about, fasting, and then the body's getting, chewing things up. And the first thing it gets rid of are, skin tags and cysts and lipomas and all this stuff. Are you guys seeing that consistently happening? I've seen, like lipomas go away and cysts go away, and it kind of, you see going away occasionally spontaneously. And I thought that was kind of interesting. But I mean, do you think that's due to the fasting? Is that what we're seeing?
I think it's just due to autophagy. So, I mean, fasting is it's an effective way to induce autophagy. But of course, we know that nutritional approaches and that intensive exercise can also induce autophagy as well. So I don't think these benefits are exclusive to fasting. I just think fasting is an effective way for inducing autophagy in the system.
Yeah, I think that's a good point to point out that exercise can do that as well. And I noticed you said you're pro exercise strength training. I think that's a common message that many people are hopefully sharing. There is a question somebody has. Tara's talking about previous history of gastric sleeve. Is trying to do a 3-day water fast. Anything to be aware of or concerned with regard to that?
No, so many individuals we've seen have had the sleeve or have had like the gastric bypass procedure. Jason and I wrote a book called Life in the Fasting Lane with our friend Eve Mayer. She had 3 weight loss surgeries. She had her sleeve removed. There's nothing in particular. It's just to make sure you stay well hydrated. Hydration isn't just water; it's water and electrolytes, and you need both. You can't just take a bunch of, say, salt. You need to take some water too. You can't just have water. You need to take the salt. So staying hydrated. And then when you do go to break your fast, just do it very slowly and very gradually. Don't try to eat a big full meal. So usually with individuals that have had weight loss surgeries, they find that they struggle with, say, like a 1 meal a day approach because they can't eat that much. So maybe having a couple of smaller meals over a shorter time span than just trying to force it all into 1 meal. So just go slowly when you do resume eating.
Yeah, and I've got one of our members here is saying it's just difficult to fast for them. Are there any tips on making it more approachable for the person that's I gotta I'll just say I've done a lot of one meal a day. I've done I think I did a 48-hour fast. I don't find it that hard for me. I don't find it something I do that often, but it's certainly I'm not worried about it. But what about people who are apprehensive and think they can't do it? How do you sort of advise them? 'Cause I'm sure you get a lot of people that think it's crazy not to eat for a day.
Yeah, so we can start out at the basics. So if someone comes to me and they think that, listen, lady, you're nuts, this is not, this is crazy. We start off at the basics just by cutting out snacking, going to 3 meals a day to 2 meals a day, wherever they're comfortable with that, and then working on their nutrition, but also working a lot on their hydration as well. It's, a lot of the times we suspect that people's appetite is being driven when they're trying to fast by electrolyte deficiency. Now, you got to remember, when you're fasting, your insulin levels are falling. You're going to be urinating out more. You're going to be losing excess water. In that excess water, we are going to lose electrolytes. So I find those individuals that are always sort of crashing between like the 18 and 20-hour mark are just not getting in adequate electrolytes. So in our practice, we always encourage people, when you wake up in the morning, add some salt to your water, put a pinch of salt under your tongue, you have some pickle juice, get in some electrolytes very first thing in the morning. And then to adjust or to take some salt throughout the day, about every 2 to 3 hours, we typically recommend. And then suddenly the fasting becomes easier. And then at the 24-hour mark, they're no longer hungry anymore. So usually with these individuals, we'll try to get them into a routine where they're comfortable and seeing that they're, not going to die from fasting, but we'll work on making sure that we're getting the hydration right. And that usually has a profound effect on their energy levels throughout the day, mental clarity, and appetite. It makes it really easy for them to go through and do 24 or 36 hours of fasting.
Okay, and I just a commentary on Cecilia saying skin tags used to be there, now they're not common. We see skin tags often being associated with type 2 diabetes or metabolic syndrome, insulin resistance. I think that's a fairly interesting. So here's another question and this is, hopefully you're willing to talk about this. There's a lot of, for whatever reason, there's a lot of concern about the immune system. Do you find that fasting has either a net negative or positive benefit on our immune function, or do we know that?
I don't think there's clinical data out there on humans and fasting. I do know at the start of the pandemic, Peter Attia shared some animal studies, but there was some, we didn't necessarily agree with them from a human perspective. And Jason wrote a nice piece on why this is. But from our clinical patients that we've worked with, we've seen it do nothing but boost immunity. People who used to get pneumonia every year aren't getting pneumonia. People that used to have allergies flare up, every spring or fall are no longer getting allergies. People that had chronic sinusitis are no longer developing chronic sinusitis. I'm someone who had pneumonia 4 times in my teenage years. I have not had it once. So we've seen this huge improvement from our patients. One of the greatest things too is these seasonal allergies. Suddenly none of our patients have seasonal allergies anymore, and it's spring when they're bracing themselves for seasonal allergies. So we've seen it do nothing but boost immune function. And just to remind everyone, Jason and I were typically doing 24 to 48 hours of fasting with our patients 2 to 3 times a week. So we are doing fairly aggressive fasting protocols. And I'm not talking 16, 18 hours of fasting daily. I'm talking full day fast or 2-day fast in the case of the 48 hours. And we've not seen it once negatively impact someone's immunity.
Yeah, I wonder if, and the question would be, if we control for, say, weight loss, maybe the fact that they're losing weight is perhaps associated with, decreased inflammatory cytokines from the excess adiposity or something like that.
There's
Found that.
Yeah, there's so many benefits. I mean, all of the gut healing that's happening. I mean, we've had people that have had colitis for years, and we fast them for 6 months, and their colitis is fully reversed on their next colonoscopy. We've seen some pretty amazing things. So yeah, from gut health improving to metabolic health improving to fat loss, and all of these great benefits. I mean, immunities should theoretically be enhanced quite substantially.
A question about electrolytes, because you mentioned the need for electrolytes. Is this plain old table salt, sodium chloride enough, or do you have to add the addition of potassium, magnesium, perhaps calcium, or any of those things above?
Yeah, so in general, most of our patient population is magnesium deficient with insulin resistance, and having sufficient magnesium levels definitely helps improve insulin sensitivity within the body. So we're big proponents of magnesium as well for individuals. For those who don't wish to take supplementation, you can simply do Epsom salt baths or make your own or purchase magnesium oil and use that at home. And that's a transdermal application of magnesium. Earlier this year, some nonsense came out about it not being as effective as oral supplements. But in the clinic, I mean, we would be checking RBC magnesium levels on patients who were taking oral supplements, and a lot of the times not seeing improvements till they actually started using the topical application of magnesium, either via Epsom salts or oil. And then we started to see their magnesium levels go up. But most of these patients at baseline are deficient in magnesium as it is. So we're big proponents of the topical, and then of course, oral magnesium L-threonate is great because it crosses the blood-brain barrier. Magnesium biglycinate is great because it's very well absorbed. Magnesium malate, magnesium taurate are also great, well-absorbed magnesiums to take. Magnesium oxides, garbage. It is not very well absorbed. Magnesium citrate's not the best absorbed magnesium, but it is absorbed somewhat, and then it can induce bowel movements if you're constipated. So it's an okay one to have on hand if you need it for bowel discomfort or gastro discomfort. So magnesium typically is a staple that we recommend. Most people feel that it helps calm their systems. So when you're fasting, you are producing a lot of noradrenaline, and people sometimes feel that they could be up at night partying when they would rather very much be sleeping before that big presentation at work the next day. So magnesium can help counteract some of the benefit or some of the discomfort or impact of the noradrenaline levels, which is another reason why it's so popular within the fasting community. And then in terms of potassium, it's just that people need potassium supplementation. If their levels are already low, Jason nor I have ever recommended it for people who did not need it for other medical reasons or did not have low potassium. In fact, when we look at our patient data, almost all of them have higher normal, if not slightly elevated potassium levels. But then a lot of our patient population is in the kidney, has kidney disease as well. So we've never really supplemented with it. People who need it, absolutely, they should take it, and we should closely monitor their levels, which we do. But we focus a lot on salt. We look at salt or sodium as the gateway electrolyte. And we found in our practice that if we're able to stabilize sodium levels, we're likely to see magnesium levels remain more stable. And then potassium levels and like calcium, everything else remains stable too.
Okay, and this is a question I'm not sure you're going to have much experience with this, but I'll ask it anyway, just to help. Heart disease, does fasting help with heart disease? And somebody's asking specifically regarding cardiomyopathy. I'm not sure if you've seen enough of that to make a decision on that, but just heart disease in general, obviously from a preventative standpoint, when we're losing weight, becoming less insulin resistant, we're going to see a benefit. But do you know of anybody with active heart disease that's benefited from fasting? And then if you know anything about cardiomyopathy, please type?
Yes. So I will tell you, we've only had a handful of patients with cardiomyopathy within our program. So not too much experience with, not enough. They've all had various kind of outcomes. So not enough clinical experience with cardiomyopathy. We never really monitored a lot of cardiac markers in our program. We're really restricted because of public health, but we have had patients come back to us and demonstrate improvement in their cardiac markers from their cardiologist. One of our patients, and I think she's reached out to you, Shawn, because she has Ehlers-Danlos. She had a slew of cardiac abnormalities, and she fasted very, very intensely over the years because she had mast cell activation. She had all kinds of things, and her cardiac disease, she was deemed to have completely reversed her cardiac issues, but we haven't seen too much be radical. I do know I'm getting asked a lot about myocarditis, because that's becoming a more popular topic of conversation now, as people are going through the whole COVID vaccination process. Fasting can definitely help reduce inflammation and cardiac inflammation. So my brother, who works with Jason and I, he experienced some myocarditis after his vaccination, and he did some fasting and had a very, very great he's recovered quite well.
Yeah, I think that's, I don't think it's sort of misinformation to put out that, reducing systemic inflammation is going to help localize inflammation regardless. So whatever you're doing that reduces systemic inflammation via better sleep, better diet, better exercise, fasting are all going to be beneficial in that regard. Here's a question that sometimes comes up. So there's a lot of concern with, we have our body is kind of a collection point for garbage. If we treat our body like a garbage can for many years, stuff accumulates. We have, stuff in our membranes and, crystals, depositing in different parts of the body. So when we start fasting, is there a concern with all that stuff being liberated and, floating around and basically quote unquote detoxing, if you will? I hate that word, but you're moving these otherwise sequestered, problematic compounds out of the fats and out of some of the other places where they're located. Do you see that? Do you see problems with that?
We've never seen issues with that at all. Occasionally, an odd skin rash that seems to come about. It's rare, and it can also be attributed to hormonal changes. It's usually almost always in women, so we can't even say that that's a quote unquote detox kind of reaction, and it seems to disappear within 1 to 2 weeks, anyways. But we've never found this sort of detox to be an issue. I do know in the fasting community in general, a lot of people will take something like activated charcoal as a binder in case, but we've never seen it be problematic or cause a worsening of symptoms. Most people feel much better once they start fasting.
Okay, well, we're coming to the end of our time here, Megan, and again, it's a pleasure having you here. Why don't you just spend the next couple of minutes letting people know a little bit more about the program, some of the stuff you have coming. I know you mentioned you have an app, and where people can go to find out more about the fasting method, and if you've got some social media you'd like to share, that would be great.
Yeah, thank you so much, Shawn. So Jason and I have moved our practice. Right now, we're all entirely online. So we have our fasting method community, which has lots of live meetings, expert Q&As on it, has courses on fasting and nutrition, but also mindset. So how to actually make this stuff sustainable and improve healthy habits in your relationship with food. So we work with the behavioral psychologist, the incredible Dr. Terry Lance. We're blessed to have her on our team. So we have our community, which you can access via web, or you can download via mobile app on the iOS store or Google Play Store, and it's called the Fasting Method. Our website is thefastingmethod.com. And then we do offer health coaching. So we have one-on-one and small group coaching sessions, as well as health consultations with experts like Dr. Nadia Pataguana and Dr. Nadir Ali, where you can do a deeper dive into your biomarkers and get some nutritional and fasting advice from them. So we've got our health coaching and health consulting, as well as our fasting method community. And you can find out all of the information on this at thefastingmethod.com. And all of our social handles are fasting methods. So you can find us on LinkedIn, Instagram, Twitter, and Facebook at The Fasting Method as well. And then you can find out more about what I'm working on specifically. My handles are Megan J. Ramos. So if you're interested in seeing some of the behind the scenes of what we're doing and what I'm doing, I'm actively trying to start a family, so I'm not fasting very much. Recently, someone asked me to try to do a day in an extended fast, and I won't be doing an extended fast for quite some time, but sharing what I'm eating and when I'm eating it. You can find out that on my social handles. But thank you so much, everyone. And thank you, Shawn, for having me on today.
Well, first of all, and good luck with the upcoming, starting the family. I wish you the best, and let us know how things go. Except we're pulling for you. Thanks, gonna say hi to Jason for me, and you guys, the rest of you guys have a great day. We'll see you guys. Actually, I won't be here tomorrow. I'm traveling, so for you guys, there'll be somebody else hosting this meeting. Okay, see you, Megan. Bye-bye, everybody.
Bye, everyone.
Take care.
Join Revero.health for a 30-day free trial to get access to live Q&A with VIP guests, social community meetings, member discounts, low-carb healthcare providers list, forum, workouts, monthly challenges, early access to podcasts, recipes, carnivore diet guide, fasting guide, shred guide, and much more.